I am a change agent, and I was not moved over here for soothiness.
Okay.
I was moved here by Mitch Katz and Hal Yee to stir things up, to change things. And I consider myself an agent of change.
Welcome to our podcast series, Health Calls with Dr. K. During this podcast series, we're going to talk about a lot of different things, but specifically it's about medicine, the human side of medicine. We all have questions about our health, and who can you turn to? The doctors that you trust.
We have a wonderful, exciting guest, Dr. Brad Spellberg, who is the CMO of LA+USC. Dr. Spellberg not only is the Chief Medical Officer, he is active clinically. He also maintains an active NIH-funded basic science lab. He has published more than 210 peer-reviewed scientific papers, and he has co-founded 3 biotechnology startup companies. Hi, Dr. Spellberg.
Good morning.
Good morning. It's nice to have you here.
Thank you.
We're going to have a lot of questions for you, and some of them are based on what people want to know about you, and a lot of it is based upon the work that you do here. You do some amazing work, and you're the CMO of LA+USC. That's a big title. Can you tell us a little bit about your journey to becoming the CMO? And
I never thought I would be a CMO. I don't have an MBA. I don't have a master's in health administration. I'm a bench scientist. I spent the first 5 years of my faculty career at Harbor UCLA, 100% grant funded, no institutional support.
wow.
And this was during the Bush years, and so NIH pay lines were falling, and I started looking a few years down the line and going, well, what if my grants don't get renewed? So I went to the department chair at the time and said, do you have any county positions? And at the time, the only position that was open was in general medicine as an academic hospitalist. Well, I had kids and I had a mortgage. And so I'm like, academic hospitalist, house, like my house. So I jumped ship from the ID division to the general medicine division, managed to not close my lab, which is still open all these years later, but totally shifted the direction of my career 5 years in. And it was in the experience of working in a very inefficient county hospital system where, your life is being driven mad by the inefficiencies and you just start fixing things to survive. And they ended up removing the CMO of the hospital at that point. The CMO downtown came in as the interim local CMO, and he and I kept interacting with each other. That's Dr. Yee at the system level. Mm-hmm. And one day he comes up to me and says, do you want to be my inpatient director? And I'll tell you how naive I was. I said, what's that? What's an inpatient director? He says, well, you go to the inpatient and find stuff that's broken and fix it. And I said, well, I'm already doing that. So you're going to give me a title. So in classic county fashion, I ended up with a title with no pay change and a bunch of administrative work to do.
That sounds about right. That sounds about right.
Right? That's the normal thing, right? And so 3 years went by, and then this CMO spot opened up, and Hal asked me if I was interested, and I interviewed for it, and here I am. I have no idea how I got here. The river of life winds you in strange directions.
That truer words were never spoken. Absolutely. Speaking about that raise, I'll come to you for that later. Don't worry about it. So, that's great. Now you are now steering the ship of the largest and busiest hospitals in the United States. That is a lot of burden to carry. That's a lot of weight on your shoulders. How do you cope with that?
I believe in the team that surrounds me. My job is not to make critical, every single decision. In fact, I don't want to make every single decision. I want to hire smart, talented people and let them make decisions. My first official act as CMO, I vividly remember it. It was 8 a.m. Monday, July 1st, 2014. And I sat down in my desk as my first official day as CMO. And there was a stack of paperwork this thick in my inbox. And I'm like, what? So I picked up the first piece of paper on the stack and I looked at it. And it was a $50 purchase order for pens and pencils for the graduate medical education office. And I'm like, are you kidding me? So bless her heart, I called Rosa into my office, my secretary. I said, Rosa, I don't ever want to see these again. From now on, if it's under $5,000, the local area manager can sign for their own freaking pens and pencils. I just, we need to be looking at the big picture vision stuff, and we need to trust our managers to manage in their areas.
I mean, speaking about the big picture, we're in the middle of a pandemic. I can't even imagine what it's like to be CMO in the middle of a pandemic. How are you doing that?
It's rough. And I will tell you the roughest part, which may actually be surprising. The roughest part is the fear and tension amongst the staff. Yeah. It's not deciding, where to get your PPE and what your policies and procedures should be. The toughest part is managing people, because the stress level on everybody delivering patient care is so high, everything gets exploded. I mean, any little thing happens and it turns into a giant mountain of a catastrophe. And so the number one job is to calm people down, right? Everything else can be sorted out. We can figure out the procedures and protocols and policies if we can keep people feeling safe and comfortable at work.
So talking about safe and comfortable, I'm sure that you've had a lot of sleepless nights trying to figure out how you're going to do that. As a leader, you're an example and people look up to you. How do you kind of cope with that? I'm just trying to put myself in your situation.
Well, I have what others have referred to as man-eating insomnia. So I don't want to sleep ever anyway.
Good.
Sort of like a shark, it's like floating along. It closes its eyes for a few seconds, but it has to keep moving. So that's like me. So the sleepless part is not new for me. Interestingly, I think my experience as a leader is informed by my mentors, my two mentors, chair of medicine when I was at Harbor, Eric Brass, and then Hal Yee, the CMO of DHS, and informed by, the 50 to 100 books on management and leadership that I've consumed. All of which suggests to me that one of the key secrets of leadership is being contrarian. When people are too relaxed, you need to turn the temperature up a little bit. Otherwise, things stagnate, change stops, efficiency slows. When things are too hot, it's the leader's job to cool things down, turn the heat lower. So we kind of have to sort of read the pulse and sort of try to move things in the opposite direction that the prevailing winds may be blowing, to try to moderate. The goal is always to sort of keep an even situation. And COVID turned the heat up. I didn't need to turn the heat up. I actually was, have been, and the people who work with me, trying to turn it down a little bit. It's okay. It's going to be okay. We're going to get through this. That's really been the key. Frankly, I think, your podcasts have been a big part of that. And I have a feeling you have the same sense that it's really necessary when the natural world around us is turning the heat up, for us as leaders to try to turn the heat back down.
Yeah, absolutely. You mentioned a lot of change. And do you feel like your role has changed a lot during this time?
Well, in some ways fundamentally, and in other ways, I mean, at a big picture level, no. Our job is to, the mission of this organization, both the hospital and the larger DHS, is to provide the best care possible to the most people possible, given a fixed amount of resources. And this is something that people who come into the system from outside often don't understand. We're not a for-profit environment. Right. We don't make money when people go to the operating room. That's not how we take care of the people that other hospitals refuse to take care of because they lose money on them. And that's our bread and butter. And we have to do that in a really efficient way. None of that has changed. It is the tactics that are necessary to get us to that point that shift. because pre-COVID, frankly, the temperature wasn't warm enough. And change was necessary in order to allow us to deliver the best, most care possible to the most people. Now we need to be using tactics that sort of turn the temperature down the other direction.
Thank you for explaining that. It's interesting that during the pandemic, I feel like I've gotten a chance to have you be in my office twice a week, which I didn't have before. And I'm talking about the town halls, obviously, which have been a great success. And I know that a lot of people have appreciated everything that you've done. It helps kind of turn the temperature down, like you said. I don't know about you, but I myself doing these podcasts, this is something new for me. This is not what I've trained for. I'm a doctor. I see patients, right? This is new. And I'm sure as your role as CMO, you have a lot of media and this kind of spotlight on you regularly. But I can't imagine that this is something that is the norm. Do you think that this is an area that you're comfortable in? And if not, how do you deal with that?
So I'm actually pretty comfortable with media and interviews because actually long before I became CMO, I had a fair amount of media exposure due to policy work that I was doing nationally on antibiotic resistance and a book that I published in 2009. So I'd done a ton of radio, news, TV, even a documentary movie. And so I find I'm pretty comfortable with the concept. I will tell you that one of the things we always struggle with in leadership is how do we communicate? How do we get the message out to everyone?
Right.
And I think the town halls are an incredibly powerful way to do that. And so that's a critical vehicle for us at this point. I think will not probably go away even post-COVID. We're learning now. And I have to give a tremendous amount of credit to two people for that vehicle. In my 6 years here, I've had 4 hospital CEOs that I've worked for. And the current one is just spectacular.
Yeah.
Jorge came in here with a vision of what this place should be. And he aligns his leadership team and staff towards that vision. And he came in here and recognized in a way that other leadership had not, and I will say I don't think I had fully appreciated it either, that we were deficient in communications, that we could intentionally and explicitly invest in a communications office that would pay back multiple fold in dividends in getting the word out about important messages. And of course, then he hired Connie Castro as our public information officer, and she is just awesome.
Yeah. And
the team that Connie has assembled to put these town halls together is phenomenal. So I think that's been a huge fortuitous advantage of leadership.
That's so nice to hear. It sounds like you guys have a great team.
It's the best leadership team I've ever been associated with. I'm really proud of this team.
That says a lot. That says a lot. I'm sure they feel the same about you. You know, the town halls are kind of funny. A few weeks ago, we learned about your eating habits, and you have been dubbed the soothiness guy. How did that come about exactly? Why are you so soothing?
So it is not in my normal nature to be soothing. I am a change agent, and I was not moved over here for soothiness.
Okay.
I was moved here by Mitch Katz and Hal Yee to stir things up, to change things. Mm-hmm. And I consider myself an agent of change. But this gets back to this concept of contrarianness. When the prevailing winds are comfortable, it's easy to settle into a decades-long pattern of, well, this is the way we did it in 1970, so this is the way we're going to keep doing it. And at that point, the leadership needs to turn the temperature up because that's no longer adequate to deliver the best care to the most people possible given fixed resources. As COVID blew up, people were going nuts. There was anger to a degree I had never experienced in 20 years of medical practice.
Wow.
And at a frontline level, just all over, amongst all types of people who work in our facility. It wasn't just doctors and nurses, it was everybody. Mm-hmm. And it was very clear that that fear and anger was counterproductive to the mission of delivering the most care, the best care we can to the most people. It became necessary, became very clear, if we're going to move forward, if we're going to be successful, we have to find a way to allow people to put into perspective what we're coming up against. One of the things I always hearkened back to was, yes, this is bad, but it isn't the worst thing society has experienced. 1918, influenza hits, 500 million people infected, 50 million deaths. They didn't know what an ICU was. They had no medications. Hospitals were laughable compared to what they are today.
Absolutely.
We need, some part of it was, let's give some perspective to people and try to provide some reassurance so that they can focus on their job. Because, one of the ways this virus wins is through fear. If you're afraid, you make mistakes. You forget to wear the mask. You forget to stay distant. It is when we're calm and rational that we can do the things we know work to protect ourselves from this virus. So that's where soothingness came from. It was a contrarian reaction to the initial fear that just tore through the world when COVID really erupted.
You make it sound like it's so natural, but I think that you're kind of downplaying it a little bit, right? Most people would buy into the fear, and you as a leader kind of rose to the occasion when we needed you the most. So I want to thank you for that.
Well, I appreciate that.
Well, you're speaking to a psychiatrist, right?
This is true.
Okay, good. I just wanted to make sure that was very clear.
Fully aware, yes.
Fully aware. Great. Okay. Well, during this time, you might have needed to process a few things or carried a few things with you. Just wanted to put it out there that you have the time if you would like to take advantage of it right now.
I appreciate that.
We're coming around to the winter months. You're talking about the science and understanding the situation, the reality of the situation that we're in. And we've talked about flu and what that's going to bring to COVID. Can you maybe give us a little bit about your thoughts about what the winter months and what we're facing?
Yeah, I think everybody is concerned about what winter means for multiple reasons. One is it's a respiratory tract virus.
Right.
Respiratory tract viruses, as a general rule, with a couple exceptions, but almost always are worse in winter months than in summer months. And in LA, summer weather extends well beyond summer months. September is the warmest, driest month in Los Angeles. So we're just now emerging into conditions in the next 2 weeks that we would in the LA area, not in Minnesota, but in the LA area, we would consider to be winter-like conditions. And we're worried that just the environmental change in and of itself will result in an uptick, not only in number of cases, but in severity. That is paralleled by looking at what's happening in the rest of the world. This is already happening in most of the rest of the United States and throughout Europe. So we're not living in a vacuum. We're looking at what's happening elsewhere. We're going, weather's changing, days are shorter, it's already spreading massively elsewhere. Boy, it's really time. We want to be soothing, but we want the saying we keep using on the town halls. In the aftermath of victory is when you tie your battle helmet on even tighter. Let's prepare for the next wave. Just because it's not here now doesn't mean it's not coming.
Have people asked you about vaccines? Has that conversation, I'm assuming, keeps coming up over and over again? And there's a lot of fear, and sometimes the word controversy is used for vaccines. Do you have any thoughts about?
Yeah, it's sad.
Yeah.
It used to be that the United States led the world in innovation and technology, and now it seems like the United States is the source of most anti-science conspiracy theories, which is really sad.
Yeah.
I'm writing an editorial for JAMA Internal Medicine as we speak, with one of the most prominent immunologists in the United States, Arturo Casadevall at Einstein. Sorry, he's at Hopkins now. And one of the points that we're making is this. Look at the Great Influenza from 1918. Look at smallpox, measles, mumps, rubella, polio, all respiratory tract viruses, all of which induce protective immunity after infection. None of them led to sufficient herd immunity to terminate the disease. Yes, they did prevent reinfection most of the times in the individual who's already infected, but because so many of the rest of the population remained at risk, the virus would just keep circling through the globe. All those viruses killed millions of people over many decades. What stopped it? Vaccines.
Yeah.
Naturally acquired herd immunity does not eradicate diseases, does not lead to 99% reductions in spread of viral infections. Only vaccines do that because we can intentionally administer them to everyone at the same time. How was smallpox eradicated? The only disease in human history to have been eradicated was eradicated by ring vaccination, an explicit strategy of targeting vaccination in high-risk people. And it's eradicated from the planet. Measles, mumps, rubella, polio, 99.9% declines from peak incidence 60 years ago. Only a vaccine has the opportunity to permanently eliminate COVID-19 from our lives. If we depend on a natural immunity strategy, the Swedish approach, it will continue to be with us for decades.
Thank you for explaining that so clearly. You do so much about explaining the science and the medicine behind things. And then at times, especially during the town halls, we get a glimpse into the man behind the white coat, which we're titling this podcast. How does it feel that people want to get to know you so personally?
I am a world-class introvert. So I'm not like, that's not, the interesting paradox is I'm very comfortable giving talks, but that you're not interacting in a social setting when you're giving a talk, right? So, I mean, I want people to feel comfortable approaching and talking to me because as a leader, you need that. You need people to know your door is always open, your email is always being checked, your phone, my phone, cell phone number is on the internet. Give me a call. But it is a little strange for someone who is so uncomfortable in social situations, which I am, to be out there that much. It's part of the job. It's part of what you do.
Well, not to make you feel uncomfortable, could you give us a little bit about yourself, something that you'd be willing to share with us, a little personal story about yourself?
Personal story. My whole lab thinks I'm a space alien from another planet.
Well, that's interesting. What planet are you supposedly from?
I think the consensus is Alpha Centauri because it's the closest star system.
Okay.
And so I've adopted this now. I think it's probably true because I don't get Earth people. I'm not just out of sync. I may be on the autistic spectrum to some degree. I'm really not even joking about that.
Okay, all right, okay.
I look around and I go, wait, what's happening? I don't understand what, huh? And then I'll say things and people react and like, wait, that wasn't what I was trying to say. So, so this is a generally, I think increasingly, people are accepting I'm a little bit strange. And I will tell you this hilarious anecdote. We had my former medical director for quality, Eric Way, who went to New York with Dr. Katz a couple of years ago. And Eric one day was working in the ER because he was an ER physician here. And he calls me and he goes, I just want to let you know that I just admitted a patient to the psych ER who came in saying she was a space alien from another planet. So I laughed and said, well, Eric, before you presume and send her to the psych ER, she only needs to go to the psych ER if it isn't true.
I couldn't agree with you more. I'm curious, did you actually go see her? I mean, you might know her.
I was off campus at the time, but that crossed my mind.
Opportunity missed. Well, thank you for sharing that. Well, are there any other things I haven't asked you about that you think it's important for the audience to hear from you?
I don't think so. I think, I think you've asked the key questions. I think the key message here is we will get through this, right? If we could survive 1918-19 and a much worse pandemic in an environment where we had much less sophisticated tools to combat it,
sure,
we will get through this. We just have to stick together.
And it's a Tuesday soothingness right now.
That's right.
Well, Dr. Spellberg, it's been an absolute pleasure. I thank you so much for taking the time. Keep up the good work.
Thank you. You too. Please keep doing these podcasts. I've gotten so much positive feedback about the work you're doing.
Wow. Thank you. That's really nice to hear. Appreciate it.
You bet.
All right. You take care.
You too.
Bye.